Cancer is not just a single disease, but a collection of diseases all characterized by the unrestrained growth and spread of abnormal cells. These rogue cells can invade adjacent tissues, disrupting their normal functions, and in severe cases, leading to life-threatening complications. The root cause of cancer lies in our very own cells, specifically in the DNA damage that may occur over time. This damage can be a result of various factors, from inherited genetic mutations to environmental triggers like tobacco smoke and radiation. But what makes cancer so complex, so formidable, is its diversity. There are over 100 types of cancer, each with its unique set of characteristics and symptoms. It's this diversity that makes understanding and treating cancer such a challenge. Now that we have a basic understanding of what cancer is, let's delve into the different types of cancer. Carcinomas, the most common type of cancer, originate from the epithelial cells. These cells are like the body's wallpaper, lining the surfaces and cavities of our body and organs, forming a protective layer. However, when these cells begin to grow and divide in an uncontrolled manner, they can lead to the formation of carcinomas. Common sites where carcinomas can develop include the skin, lungs, breasts, and digestive system, essentially any area that has epithelial cells. For instance, the most frequently diagnosed cancer in the world, breast cancer, is a type of carcinoma known as ductal carcinoma. Similarly, lung cancer, a leading cause of cancer-related deaths globally, is predominantly a carcinoma, specifically non-small cell lung carcinoma. The symptoms of carcinomas can be quite diverse, depending largely on where in the body the cancer develops. A skin carcinoma, for example, might present as a new mole or a change in an existing one. Lung carcinomas might lead to persistent coughing, chest pain, or shortness of breath. Carcinomas in the digestive system can cause symptoms ranging from difficulty swallowing to changes in bowel habits. Despite their prevalence, understanding carcinomas and their symptoms can help in early detection, which dramatically improves treatment outcomes. Remember, no symptom should be overlooked, and any persistent or unusual changes should be promptly discussed with a healthcare professional. Although carcinomas are common, they are far from being the only type of cancer. Sarcomas, although less common, can be quite aggressive. Now let's delve a bit deeper into sarcomas. These cancers originate in the connective tissues of our bodies. When we talk about connective tissues, we're referring to bones, muscles, and blood vessels. These tissues are like the framework that holds our body together. So, imagine a cancer that can potentially compromise this framework. That's what sarcomas can do. Their infrequency, however, should not lull us into complacency. Sarcomas, despite being less common than other cancers, can be quite aggressive. They can grow quickly and spread to other parts of the body. This potential aggressiveness underscores the importance of early detection and treatment. While sarcomas are less frequent, another type of cancer, leukemia, is often widely recognized. So let's turn our attention to leukemia next. Leukemias affect the blood and bone marrow, while lymphomas develop in the lymphatic system. Let's delve into these two types of cancer to understand them better. Leukemias are cancers that begin in the bone marrow and result in high numbers of abnormal white blood cells. These cells are not fully developed and are called blasts or leukemia cells. Their rapid production and accumulation in the bloodstream prevent the bone marrow from producing healthy white blood cells, red blood cells, and platelets, leading to problems like anemia and bleeding. There are various types of leukemia, with some forms being more common in adults and others in children. The common types include acute lymphoblastic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, and chronic myeloid leukemia. The course of the disease and treatment options depend on the type of leukemia and the patient's age and overall health. On the other hand, lymphomas are cancers of the lymphatic system, a part of the body's immune system. They start in the lymphocytes, which are white blood cells that help the body fight infections. Lymphomas are broadly classified into Hodgkin's lymphoma and non-Hodgkin's lymphoma. The symptoms may include swollen lymph nodes, fever, and weight loss. While these cancers affect the body's blood and immune system, there is another type that affects our control center, the central nervous system. Central nervous system cancers affect our body's control center, the brain, and the spinal cord. This group of cancers, though not as prevalent as others, pose a unique challenge due to the critical organs they target. Central nervous system cancers encompass a broad range of malignancies, including brain tumors and spinal cord tumors. These cancers can originate from various types of cells within the central nervous system, leading to diverse subtypes, each with their unique characteristics. Brain tumors, for example, can be gliomas, meningiomas, or pituitary adenomas, to name a few. They can cause symptoms like headaches, seizures, or changes in personality due to their location and the pressure they exert on the surrounding brain tissue. Spinal cord tumors, on the other hand, might present with back pain, numbness or weakness in the limbs, or loss of bladder function. These symptoms arise from the tumor pressing against the spinal cord and disrupting the signals traveling between the brain and other parts of the body. The complexity and diversity of central nervous system cancers make them a challenging adversary in the fight against cancer. However, advancements in medical technology and research are improving our understanding and treatment of these conditions every day. Now that we have a better understanding of the types of cancer, let's talk about the common symptoms. Cancer can manifest in various ways, but some symptoms are more common than others. First off, persistent fatigue. It's not just about feeling a bit tired after a long day. This is an unexplained, crushing tiredness that doesn't improve with rest. It's your body's way of saying something's not right. Next up, unexplained weight loss. If you're shedding pounds without trying and it's not due to a change in diet or exercise, it might be time to question why. Another common sign is changes in skin or moles. Whether it's a shift in size, color, shape, or texture, any noticeable changes should be examined by a healthcare professional. Persistent pain is another symptom to take seriously. If you're experiencing ongoing pain that doesn't have an apparent cause or doesn't improve with typical treatments, it's time to get it checked out. Changes in bowel or bladder habits can also be a signal. If you're noticing blood in your stool or urine, or any persistent changes in function, it's crucial to consult a healthcare professional. Difficulty swallowing or persistent indigestion may also be indicative of cancer, particularly in the upper gastrointestinal tract. These symptoms shouldn't be ignored or brushed off as just another bout of heartburn. Another symptom to be on the lookout for is a persistent cough or hoarseness. If your voice changes and doesn't resolve, or you have a cough that just won't quit, especially if it's accompanied by other symptoms, it's time to seek medical advice. Lastly, we come to lumps or thickening. Whether it's in the breast, testicles, or anywhere else, unexplained lumps should always be examined promptly. It's better to err on the side of caution when it comes to these signs. Cancer is a formidable adversary, but knowledge is power. By understanding these common symptoms, you're equipped to spot potential early signs of cancer. Remember, early detection greatly improves the chances of successful treatment, so stay aware, stay vigilant,